I thought today would be a great day to talk about OP babies in labor. OP babies are also called sunny side up babies. So an OP means that the occiput is posterior. And so baby is head down and the back of their head, the occiput, is against the spine and they're looking forwards basically out of your belly button. We would ideally like your baby to be OA for delivery, and so that means their occiput is anterior, so their occiput is around your belly button, and they're looking back towards your spine. In an OA position, babies have their chin tucked, and so that means the smallest diameter is what is coming down and through your pelvis, whereas an OP baby, as they descend, their chins are a little bit lifted, and so a larger diameter is coming through your pelvis, and it's a little bit harder for them to navigate the curves of your pelvis. OP babies are super common. A telltale sign that your baby is OP when you are maybe laboring at home before you go to the hospital would be that your contractions are presenting with a lot of back labor, because the occiput, right, the hardest part of baby's head, is putting pressure against your sacrum and putting pressure on your spinal nerves. And so that's causing that back labor. That's why counter pressure can feel really great, or like water therapy with the hot water just like pounding down on your low back can feel really, really good if your baby is OP. You also may notice that your contractions are coupling. And so that means like you have 2 contractions and then a break, and then 2 back-to-back contractions and then a break. And because of like the way that the baby is in your uterus, that's why the contractions pair up. So those are 2 signs that you might notice at home to be like, oh, I learned about this. I think my baby might be sunny side up. Things that you can do to encourage your baby to move around, to spin, hopefully before you get to push time, would be making sure you're moving, not just being a sitting duck during all of your contractions, but you can be doing hands and knees. You can be doing downward dog. You can be doing really any like asymmetric position. So like Captain Morgan's with one leg up, side lying releases, extended runners, lunges, kind of any of those positions where you are in an asymmetrical position opens up more space in your pelvis to get baby to spin around. Things to know about OP babies is that while yes, you may have back labor, you may also have a longer labor. And so an OA baby, their chin is tucked and they're kind of applying even pressure to your cervix for your cervix to dilate and efface. And an OA baby, their chin is a little bit lifted, and so that's not gonna be applying the same amount of even pressure. And so that can result in a lot of starts and stops. So you may feel like you are in active labor and you get to like 4 or 5 centimeters dilated, and then you might just sit there for a little while, still contracting, but maybe your cervix, like your dilation hasn't changed in quite a few hours. And then all of a sudden you'll pick back up and now you're 8 centimeters dilated. And so those starts and stops can be kind of symbolic of an OP baby. And then the other thing is that pushing may take a little bit longer, and it may feel really frustrating for the first hour or so that you're pushing, because again, that like wider diameter is trying to engage and come navigate that curve. And so it can feel less productive as you're trying to get baby down and out. So lots of people have OP babies. It is super common. There's a lot of fear about OP babies, probably because of social media, but these are some tools. You can use them and it'll be okay. Now you know. Bye.